Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been trying really hard with my diet, especially cutting down on sugars and carbohydrates. Despite that, my blood glucose levels are still fluctuating quite a bit, usually between 115 to 150 milligrams a liter. It's been a bit frustrating, not seeing the numbers stabilize more.
I can understand that can be quite discouraging. How about your diabetes medications? Are you taking them as prescribed every day?
Yes, I've been very strict about taking my medication regularly. We had talked about maybe adding acarbose or even insulin if things don't improve. I'm not sure what's best at this point.
We'll review your medication in detail in a bit. You mentioned earlier about experiencing pain that might be from kidney stones.
Right, the pain's been on and off, but mostly on the right side. I've had kidney stones before, so I know what the pain feels like. It's been quite sharp at times. Toradol has helped in the past, but we discussed using Vicodin for the pain if it gets unbearable.
Yes, managing that pain effectively is crucial. How have your tremors been lately?
The tremors in my right hand started a few months ago. They were quite noticeable, and sometimes I couldn't hold things properly. The anti-seizure medication seems to help, though, and the explosive pains in my neck that shot up to my head have calmed down since I started the medication.
Good to hear the medication is working for the tremors and pain. How is your psoriasis and the psoriatic arthritis?
The Enbrel has been effective for the arthritis, and mostly my skin has been under control, but I still have persistent patches on my back and thighs. It can be quite bothersome at times.
We'll keep monitoring that as well. Moving on to your cardiovascular health. Are you still following the lifestyle changes we discussed after your heart attack?
Yes, I've made those changes a permanent part of my life now, especially being active with my granddaughter. It's helped with my weight too. I've lost about 10 pounds recently.
That's excellent progress. It's good to see you engaging in physical activity and enjoying time with your family. It helps both physically and mentally. Now let me go over some of your recent clinical measurements and lab results to better understand your current health situation and plan accordingly.
Please go ahead, doctor.
Your blood pressure today was a bit high at 160/90, which you attributed to traffic stress. We'll keep an eye on that. Your heart rate and other vitals are within normal ranges. Your latest lab tests show your HbA1c at 7.8%, which indicates that your blood sugar levels over the past few months have been higher than ideal. Your serum creatinine is at 1.4 milligrams per liters, and your eGFR is 55 milliliters per min 1.73 meter squatters, which puts you in stage 3 chronic kidney disease. Your cholesterol levels are also elevated, with a total cholesterol of 220 milligrams per deciliter, LDL at 130 milligrams, and triglycerides at 250 milligrams.
That seems like a lot to manage.
It is, but you're not alone in this. For your diabetes, increasing the frequency of monitoring your blood glucose to twice daily will help us get a better handle on your fluctuations. Based on those readings, we can decide if adding acarbose or starting insulin would be appropriate. For your kidney stones, continue managing the pain as needed, and we'll monitor for any changes in size or number through follow-ups.
And what about my cardiovascular health?
Continue with your current lifestyle modifications. I'm not recommending reintroducing aspirin at this point due to your anemia, but we'll revisit this as needed. It's important to keep up with your diet and exercise, as they are integral to managing not just your diabetes, but also your cardiovascular health.
Thank you, doctor. It's a lot, but I'm glad we have a plan moving forward.
Absolutely, and we'll continue adjusting the plan as needed based on how you respond to the treatments and any new symptoms that may arise. Regular follow-ups will be crucial.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been feeling really out of sorts for a while now, almost 6 months. Despite getting a good night's sleep, I'm still needing to take daily naps. I just don't have the energy I used to.
I understand that must be quite frustrating for you. Could you tell me more about your sleep patterns and how you've been feeling during the day?
Well, even with 7 to 8 hours of sleep, I wake up feeling exhausted. I tried to stop using my CPAP machine, thinking maybe it was disrupting my sleep, but not using it hasn't helped either. And then, there's this overwhelming lethargy throughout the day. It's like I can't get myself to do anything productive.
Have there been any changes in your lifestyle or habits recently that might be affecting your energy levels?
Yes, actually. I started drinking again after staying sober for 2.5 years. I initially thought a little alcohol might help me sleep, but now it's about half a bottle of wine each night. I know it's not ideal, especially with my medications.
I see. Resuming alcohol can indeed interact with your medications and affect your sleep and mood. How about your mood and mental health in general? You mentioned feeling depressed.
It's been rough. I feel down most days, and nothing seems to bring me joy anymore. I've been on Wellbutrin, but I'm not sure it's helping. Adderall used to help me focus and feel alert, but now it just makes me more tired. It's all so confusing.
It sounds like you're dealing with quite a bit between your mood and the medications. How about your diabetes management? You mentioned concerns about your blood sugar levels.
My blood sugar has been all over the place. I have these episodes of hypoglycemia in the mornings sometimes, which scares me. I'm on metformin and lisinopril, but maybe we need to look into adjusting those.
Absolutely. We should review your diabetes treatment to ensure it's still the best approach for you. Managing blood sugar levels can significantly impact your energy and overall health. Now, about the medications for anxiety and sleep. How have they been working for you?
I use trazodone occasionally, but it makes me groggy the next day. I try not to take lorazepam often because of its sedative effects, which I don't need more of. Honestly, doctor, it feels like I'm stuck in a cycle of sleep issues, low energy, and trying to medicate my way out, but nothing's working.
It can be really challenging to find the right balance with medications, especially with multiple health concerns like yours. Let's take a thorough look at everything today. I'll go through your recent clinical values, and we can formulate a plan moving forward.
Thank you, doctor. I just want to feel normal again, to have the energy to get through my day without feeling like I need to sleep all the time or rely on alcohol.
Of course, I completely understand. Let's start with your recent lab results. Your blood pressure today is 135/85 milliliters, which is slightly elevated. Your fasting blood sugar was 142 milligrams per deciliter and postprandial blood sugar 188 milligrams per, which shows that we need to adjust your diabetes management. Your hemoglobin A1C is at 7.2%, indicating that your overall glucose control can be improved.
What does that mean for my treatment?
For your treatment, I recommend we start by adjusting your metformin dose to better manage these hypoglycemic episodes. It's also crucial to stabilize your meal and medication timings to avoid any drastic fluctuations in your blood sugar. Additionally, I strongly recommend you return to using your CPAP machine every night. It's likely contributing to your fatigue if your sleep apnea isn't properly managed.
I understand. And the alcohol?
As for the alcohol, I recommend seeking counseling to address this, as it can complicate your medication interactions and overall health. I'll also schedule a follow-up with your psychiatrist to review and possibly adjust your psychiatric medications, especially considering your current symptoms and alcohol use.
Sounds like a plan. Thank you for helping me figure this out.
You're welcome. Remember, it's important to tackle these issues one step at a time. We'll follow up regularly to see how you're doing with these changes.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Today, I'd like to discuss some of the side effects you might experience from radiation therapy. It's important to be aware so we can manage them together effectively.
Yes, please. What should I expect?
The most common side effect is fatigue. You might feel more tired than usual. It's not just a physical tiredness, but you might feel mentally exhausted as well.
Is there anything I can do to manage that?
Yes, maintaining a light exercise routine can help, as can ensuring you get enough rest. Nutrition is also crucial. Additionally, skin irritation in the treatment area is common, so it's important to avoid tight clothing and harsh soaps.
Will these effects go away after the treatment ends?
Yes, they typically subside a few weeks after treatment concludes, but we'll monitor you closely and adjust our approach as needed to keep you comfortable.
Now look at question 26.
Living in a rural area poses unique health challenges, especially for women. One of the major issues is access to medical facilities. Many women have to travel long distances for health services, which delays seeking necessary care.
That's true, and it's not just about distance. There's also a lack of specialized healthcare providers, like gynecologists or maternal health specialists. This leads to higher rates of maternal and infant mortality.
Exactly, and let's not forget the role of education. Many women in rural areas lack health literacy, which affects their health choices and increases their risk of diseases.
So, what can be done to improve this situation?
Improving transportation facilities, providing mobile health clinics, and increasing education about health will be crucial steps in addressing these disparities.
Now look at question 27.
I understand that this is a very hard time, but we need to discuss the passing of your father. Despite all our efforts, he passed away early this morning.
No, that can't be right. He was doing better last night. Are you sure?
I'm very sorry for your loss, and I wish the news were different. We monitored him throughout the night, and despite our best efforts, his condition deteriorated.
But there must be some mistake. Maybe he's just unconscious.
I assure you, we have double-checked everything. It's important now to talk about the next steps and how we can support you through this grieving process.
Now look at question 28.
In preparing our care plan, we need to consider Mr. Lopez's cultural background. He follows traditional practices and prefers natural remedies.
That's important to know. We need to integrate this into our treatment plan. Perhaps we can consult with a cultural liaison to ensure our approach respects his beliefs.
I agree. Also, understanding his dietary restrictions and any traditional ceremonies that are important during his recovery could be beneficial.
I'll arrange a meeting with his family to discuss these aspects more thoroughly. It's crucial we make him feel comfortable and respected in his care environment.
Now look at question 29.
How have you been feeling since our last appointment? Any progression in symptoms?
I've noticed more trembling in my hands and my movements are becoming stiffer.
That's typical with Parkinson's as it progresses, but we can adjust your medication to help manage these symptoms better. Are you currently experiencing any side effects from the medication?
A little nausea, but it's manageable.
Good. We'll continue monitoring that. It's also beneficial to incorporate physical therapy into your routine to help with the stiffness and improve your mobility.
Now look at question 30.
I see you've been prescribed a new medication. It's important to talk about how it interacts with your current medications.
Yes, I'm a bit worried about that. What should I look out for?
Your new prescription can increase the risk of dizziness when combined with your current blood pressure medication. It's also important to avoid alcohol, as it can enhance this effect.
That's good to know. Are there any other side effects I should be aware of?
You might experience some mild headaches or nausea. If these become severe, please contact your doctor immediately. Always take the medication with food to minimize stomach upset.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at extract 1.
Good morning, everyone. It is indeed a pleasure to have the opportunity to speak to you all today at this prestigious academic forum. The topic I'm going to delve into is the role of advanced neurosurgical interventions in treating cerebrovascular accidents, commonly known as strokes, within low-resource settings. This topic not only challenges our clinical practices, but also pushes the frontier of global health equity. To begin, let's ground our discussion in the reality of global health disparities. According to a study published in the Harvard Health Policy Review, nearly 5 million individuals globally suffer from conditions requiring neurosurgical intervention, yet lack adequate access to care. This disparity is most pronounced in low and middle-income countries, where healthcare infrastructure is not sufficiently developed to support complex neurosurgical needs. A relevant case study that underscores this issue involved a patient from a rural region in Tanzania, a 54-year-old male who suffered an ischemic stroke. The patient experienced significant delays in receiving appropriate care due to the nearest facility equipped to handle such cases being over 300 kilometers away. By the time he received surgical intervention, irreversible damage had occurred, significantly impacting his quality of life post-surgery. This case is a poignant reminder of the critical need for accessible neurosurgical care in these regions. In light of such challenges, one promising approach is the implementation of mobile neurosurgical units. These units, equipped with essential neurosurgical tools and staffed by skilled personnel, travel to remote areas providing timely interventions. A paper published in the Journal of Neuro-interventional Surgery highlighted the effectiveness of mobile units in reducing the time from stroke onset to intervention, which is crucial for positive outcomes in stroke management. Moreover, training and capacity building form the cornerstone of sustainable healthcare improvements in low-resource settings. For instance, the partnership between local hospitals and international neurosurgical experts can facilitate the transfer of knowledge and skills necessary for performing complex procedures. An example of this is the NeuroLink initiative, a collaborative effort between Harvard Medical School and several hospitals in sub-Saharan Africa. This initiative focuses on training local surgeons in advanced techniques for managing cerebrovascular accidents. The long-term goal is to establish self-sustaining neurosurgical centers of excellence in these regions. However, the path forward is not devoid of challenges. Issues such as political instability, economic constraints, and cultural barriers can impede the progress of such initiatives. Therefore, it is imperative to engage with local communities and governments to tailor interventions that are culturally sensitive and economically viable. Advancing neurosurgical care in low-resource settings requires a multifaceted approach that encompasses technology, training, and community engagement. By investing in sustainable healthcare solutions and fostering international collaborations, we can significantly enhance the capacity to manage neurosurgical conditions globally, ultimately reducing the healthcare disparities that currently exist. Thank you for your attention, and I look forward to our discussion on how we can collectively address these challenges.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Good morning, esteemed colleagues and guests. Today I will delve into a comprehensive analysis of the neuro-oncological management of glioblastoma multiforme, GBM, focusing on the integration of advanced immunotherapeutic strategies and their neurological implications. This talk is based on an in-depth case study and recent scholarly articles from Harvard and other leading institutions. Glioblastoma multiforme remains one of the most challenging malignancies to treat, with a median survival time of approximately 15 months post-diagnosis. The aggressive nature of GBM and its profound resistance to conventional therapies necessitate a shift towards more innovative approaches. In recent years, immunotherapy has emerged as a promising avenue, particularly the use of immune checkpoint inhibitors and chimeric antigen receptor (CAR) T-cell therapy. Let's consider the case of a 58-year-old male patient, Mr. Smith, who was diagnosed with GBM. After initial treatment with surgical resection followed by radiotherapy and temozolomide, Mr. Smith's disease unfortunately progressed. Given the lack of substantial improvement with standard therapies, the decision was made to enroll him in a clinical trial focusing on PD-1 inhibitors, a form of immune checkpoint therapy. The theoretical framework for using PD-1 inhibitors in GBM is compelling. These inhibitors function by blocking the PD-1 protein on T cells, which cancer cells exploit to evade immune detection and destruction. By inhibiting PD-1, these therapies aim to enhance the body's immune response against cancer cells. However, as we explore these new territories, we also encounter significant complexities related to their neurological effects. During the course of treatment, Mr. Smith developed symptoms indicative of immune-related adverse effects, including headaches and cognitive changes, which were initially subtle but gradually progressed. This presentation mirrors findings discussed in a recent study from Harvard, which highlighted that neurological adverse effects, although less common than systemic ones, can manifest profoundly when they do occur. The study emphasizes the importance of early recognition and management of these symptoms to prevent long-term consequences. Furthermore, the discussion extends to the management of such adverse effects. In Mr. Smith's case, the onset of symptoms prompted a thorough neurological evaluation, including MRI scans and CSF analysis, which indicated mild encephalitis. The management involved high-dose corticosteroids, which led to a partial resolution of symptoms, showcasing the delicate balance between treating the cancer and managing therapy-induced complications. Beyond individual patient cases, the broader implications of these findings are significant. They compel us to rethink our strategies in neuro-oncology, particularly regarding patient selection for immunotherapy, monitoring protocols, and management strategies for adverse effects. Moreover, they underscore the need for interdisciplinary approaches in managing GBM, involving neuro-oncologists, immunologists, and neurosurgeons. The integration of immunotherapy into the treatment regimen for GBM represents a frontier fraught with both promise and challenges. The case of Mr. Smith illustrates the potential of such treatments to extend life, but also highlights the critical need for vigilant monitoring and management of neurologic complications. As we move forward, ongoing research and clinical trials will be paramount in optimizing these therapies, improving outcomes, and enhancing quality of life for patients suffering from this devastating disease. Thank you for your attention. I look forward to any questions you may have about this complex and fascinating topic in neuro-oncology.